I am Dr. Heather Moore, owner of Total Performance Physical Therapy, and we are going to talk about why the inside of your foot hurts tonight. So there's a couple of reasons why it can, and this is why sometimes having a proper diagnosis, not necessarily what Google says or WebMD says, but what actually a medical professional says, is important, because the inside of the foot pain could be a couple of things. So I'm going to give you a couple things to differentiate what it may be, but it is really important that you talk to somebody in the medical profession before necessarily heading on with treatment. So the first thing that when we talk about pain on the inside of the foot, basically we're talking about the inside of the arch here. Sometimes it can go up into here, okay? So right up in here, you have kind of two structures that you can become inflamed. So you have your plantar fascia, which can develop into plantar fasciitis, and this can become very painful. Or you have your tibialis anterior, which is going to come up in here and kind of go down across here. So two different injuries, two different reasons why you have pain on the inside of your foot. Both could be occurring. This pain in here is commonly associated with shin splints. You might have some tibial stress syndrome also. So most likely pain in the bottom of your foot or pain on the inside of your foot is not caused by one thing. And that's really where you need to look at your foot and have somebody look at your foot, because first of all, footwear is very important when we're talking about the foot. So if you are experiencing any pain either on the bottom of your foot, your heel, the inside of your foot, it's really important not to walk barefoot. It's really important not to wear flip-flops. It's really important to have a supportive shoe on at all times, like a sneaker. And a good sneaker, not like a fashion sneaker, a good running shoe, walking shoe, because you need that support on the bottom of your foot. A good shoe is designed to do two things. It's designed to give you stability, and it's designed to give you mobility. So depending on what type of foot you have, you want to buy a shoe that kind of helps you with your deficiency. But if you have pain on the bottom of your foot or on the inside of your foot, wearing the proper shoe or wearing a shoe at all times is really important. That's right when you get up out of bed through to the evening. Having that proper footwear is going to help some of that inflammation that's going on. Now, I have very flat feet. I don't know if you can really tell because I'm wearing black socks and on a dark carpet, but my feet are extremely flat, so I have absolutely no arch. So what happens when I'm going to kind of force an arch into my foot, what happens is when I go to walk, my foot goes down. So a lot of times what happens is when you don't have an arch, you wind up stretching a lot of this muscle on the inside. So when you're dealing with that foot pain on the inside and you don't have an arch and you don't wear a shoe, you are collapsing that foot each time. So instead of this muscle being allowed to have any rest because your shoe will support you, your shoe will give you an arch, what happens is every time that you step down, you go like this, and you're actually stretching all of this in here, and you're irritating all of this. You're also stretching out the bottom of your foot, which is the plantar fascia. So instead of having this nice arch and being supported by a shoe, you wind up flattening it out and stretching it out. So every time you take a step, you're flattening and you're irritating that plantar fascia. You're flattening and you're irritating this muscle in here. Now, you need to be careful because this can develop into something a lot worse. This can develop into something a lot worse. So when you start to have the signs, you want to really pay attention to them. When you have an irritation of your muscle going up in here, it's really actually pretty easy to figure out if this muscle is affected. You just want to take your fingers and you just want to kind of come up in here. So you go to the back of this bone in here, your malleoli, and you want to just start walking your fingers all the way up. A lot of times people who have inside foot pain are going to have pain up in here. Sometimes you don't even need to press real hard, okay, to find it. Now if you're pressing here and you're like, nah, not really, nothing, and you still have pain on the inside of your foot, may not be due to this area. Still could, just you may not be pressing on the right spot. And then you want to take your finger and kind of go into the bottom of your foot and see if that hurts. And that's the plantar fascia. So it's kind of just a quick way to initially look and see which of those areas are bothering you or which it could be attributing to. When you feel those areas, what you want to do is you want to look for tenderness. You want to look for any sort of pain. It should not hurt to touch here at all, okay? And sometimes when you're doing this, you're going to go all the way up and be like, yep, that all hurts. The further it goes up, the more serious the issue is. It may only be hurting here. This may be where you feel the pain, but it could be all the way up into here. It could be a little bit into the back, into this gastroc area. So you want to be aware that just because you have pain on the inside of your foot doesn't mean that's where the problem is. It just means it's where you're feeling it. So what can you do about that pain on the inside of your foot? Well, again, we covered footwear. Super important to allow your foot to have that support as you walk, as you run. So having a proper shoe on at all times, even if you have to get a note written for work, really important. The next thing you want to do is you want to ice. All right, just take a bag of peas, and again, you want to ice from here and all the way down. So if you haven't had it properly diagnosed and you're just like, oh, I got pain on the inside of my foot, at the end of the night, take a bag of peas and ice the bottom of your foot and ice all the way up into here. And that's going to help some of that inflammation. So 15 minutes, nothing more. All right, and then finally what you want to do is you want to do some sort of what we call myofascial release, something to loosen up the muscles. So here I have a BC ball. It's my favorite. If you watch our other videos, we have a lot on how to use this on other parts of the body. But what you can do is you can take this with your hand and you can go right in here. A lot of times, if this is a very painful area for you, you're not going to be able to tolerate much more than your hand going in here. So you kind of work your way up nice and easy, going all the way up, going all the way down, all right? You don't want to necessarily run over the bone. It's not going to harm it. It just doesn't feel good. And then you want to take this and you want to put it on the floor and you want to run it around on the floor. Now, I know people have golf balls and lacrosse balls, and they work too. This is just the best that I have found personally to get into all of those ridges. So just kind of running it around over here and underneath here will help break up some of that tissue. Now, what you have to be aware of is if you are suffering from bottom of the foot pain, inside of the foot pain, it could be coming from a weakness in your hips, allowing your foot to collapse. And again, this is where having it diagnosed professionally to see exactly where in that kinetic chain, where in that leg you're failing, and you're getting that overuse issue is really important. So you could start to do some hip exercises, like a hip hike, in order to strengthen the glute medius. You could do some lateral raises out to the side, also strengthening that glute medius. You want to identify where the problem is. The inside of your foot just doesn't automatically start to hurt for no reason. And you know, if you sprained your ankle, then that's probably why the inside of your ankle hurts. But if you didn't and you're just like, no, I've noticed some pain on the inside of my ankle, it's coming from a reason, and you need to figure out exactly what that reason is. Your plantar fascia may be inflamed. Well, why is your plantar fascia inflamed? Why is the bottom of your foot inflamed? If you don't figure out why, it's going to continue to occur. Even after you ice and after you stretch, and maybe you get an injection, if you don't figure out the why, it will come back. Same thing if it's coming from inside here. You can ice this, you can do the BC ball, you can fix it, so to speak, but you got to figure out why it's coming from here, especially something like this. This is indicative of something greater going on that you really need to address and you need to figure out. So the foot, when the foot hits the ground, it controls the entire leg. So the leg is controlling the foot's controlling the leg, and if it's not working in unison, you're going to get some failures. And sometimes, a lot of the times, just pain on the inside of the foot is the first sign of a much bigger failure going on somewhere in the hip, in the knee, somewhere where we really need to take a look at it. So be aware of just kind of saying, it's just my foot, I'll just quickly treat it, I'll put a brace on it, I'll do this, I'll do that, I'll just put a little ice on it and be done with it. Unfortunately, that's not all that it's going to take. You really need to figure out exactly why you're having pain on the bottom of your foot and how high up it goes, how high up that dysfunction goes. If you are experiencing pain in the bottom of your foot and you would like a doctor of physical therapy to give you a free consultation and figure out where that break is in chain, all you have to do is call our office at 215-997-9898, and we'd be happy to take a look. Thanks and have a good night.